30-year-old female patient is brought into the emergency unit. Her name is Mary Jane. She presents with shortness of breath, generalized body rash, and palpitations. What could this be? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. Have you ever heard of the word anaphylaxis? This is a severe kind of allergic reaction that is triggered by the release of chemicals or mediators into your bloodstream, and they come from the mast cells and the basophils. Upon further inquiry with Mary Jane, she says to me that it was just a few minutes ago when she had her favorite meal with her family, which was chicken, fish, eggs, and salads, amongst other things. She couldn't believe me when I said to her that it is possible that one of the ingredients that was in the food is the one that triggered the symptoms. Allergic reactions do not always present upon initial exposure to the allergen. In fact, in most cases, you find that the patient has been exposed to this allergen previously on 2 occasions or more before they start reacting. Depending on what system is involved, allergic reactions can present as follows. If it is the skin that is involved, the patient could complain of itchiness of the skin, generalized body rash, or even redness of the eyes. When it comes to the respiratory system, the patient could complain of sneezing quite a lot, or tightness of the throat, and even wheezing of the chest. And sometimes it is possible that one could confuse an allergic reaction to just an ordinary gastroenteritis, which is diarrhea and vomiting, because allergic reactions can in most cases do exactly that. They can trigger diarrhea and vomiting sometimes. As I continued to examine Mary Jane, I had noticed that her blood pressure was starting to drop. Her breathing was even getting worse, getting more labored. Oxygen saturation was about 86% on room air. We gave her a shot of adrenaline intramuscularly on her thigh, which was 0.5 milligrams IMI. There was only slight improvement in her symptoms. We also decided to give her a dose of cortisone, 200 milligrams of Solucotef. Only minimal improvement was noted after doing that. However, Mary Jane's condition was even getting worse. The breathing got even worse. The oxygen saturation was even dropping even further. It was about 70%. One thing that I was too concerned about was the level of consciousness was even dropping further. What we call the Glasgow Coma Scale, that signifies your level of consciousness, was even below 8. And at that point, as a medical professional, you have to make sure that you protect the airway of the patient, which means the only choice that I had was to intubate Mary Jane. Intubation was done successfully, but during intubation, I noticed that the airway was significantly swollen. Blood pressures also were starting to get worse. The next step that we took was we had to give her inotropes. This is, in most cases with inotropes, we usually use adrenaline infusion or Dobutrex infusion in order to improve the activity of the heart and also to pick up the blood pressures. Mary Jane was lying there, intubated, on drips infusion, and I had to speak to her fiancé to let him know exactly what's happening to Mary. He was a bit unsettled and he was worried about the possible outcomes. Yes, indeed, anaphylactic reactions can be fatal at times. I did understand his concerns. Firstly, when a patient with an allergic reaction comes in, a healthcare professional should have a high index of suspicion, and these patients need to be treated promptly, very quickly. The first thing that needs to take place is they need to be given a dose of adrenaline. The next thing is you give them antihistamines, as they have shown to be able to improve the patient's condition in allergies. Thirdly, you can also give them a cortisone, because they do improve patients with allergic reactions. If blood pressures do not improve at all, you may have to consider giving a bolus of fluid. It could be Ringer's lactate or even Voluven. Observe how the patient is doing. In the process of giving fluids, you also have to make sure that you don't worsen the respiratory system by overloading them with fluids. You need to monitor closely how much you're putting into the system and how much urine output you're getting from them, because there has to be a balance, because the patient might even drown from the fluids that you're giving. So in a nutshell, allergic reactions, anaphylaxis, can be fatal to a patient. When it comes to investigations, what is it that you need to look for? One of the tests that we do to check if this was an allergic reaction or not is what we call an IgE. IgEs are immunoglobulins that also form part of your immune system. The levels tend to pick up whenever there is an allergic reaction specifically. Other tests that you can do is a phagocytop or RAST, but those ones usually take a bit longer to come out. What other additional tests you can look at? I would consider a white cell count, which is an infection marker. In most cases, allergic reactions hardly pick up your white cell counts, because they are not more of an infection, but rather more of an inflammatory process. You can also do your CRP, which is your C-reactive protein. This marker usually picks up nicely whenever there's an inflammatory process. You might find that in a case of Mary Jane, the CRP will be quite elevated significantly. Amongst other things that you have to do as a healthcare professional, you need to consider investigations such as chest x-rays. Reason being that a patient who comes in with shortness of breath, it could be a whole lot of things. It could be from chest infections, it could be from heart failure, and a whole lot of other things. However, with allergic reactions or allergies, you would find that your chest x-ray looks normal. But one thing remains, the patient would have wheezes in their chest. Like as I explained before, wheezes are a whistling sound that comes from the narrowed airways that are quite inflamed. Another thing that needs to be observed very closely in a patient with anaphylaxis or anaphylactic shock is the blood pressure. In most cases, the blood pressure would translate to the heart rate that you see in these patients. A low blood pressure, in most cases, you would find that the heart rate would go up. But as you gently improve on the blood pressure, the heart rate would start coming down nicely. Like in the case of Mary Jane, we moved from a heart rate of 135 beats per minute to 86. Blood pressures were starting to improve nicely. It was eventually 120/83, which is a very good blood pressure for any patient. But please be careful with any patient that you are resuscitating. If there is improvement, you should also observe for the worst case scenario at some point. A patient whose blood pressure, or let's say the heart rate, moves from 135, drops gently, just make sure that it doesn't go below 60, it doesn't go below 40. Otherwise, it would mean that even though there seems to be improvement, something else is happening. A patient who presented with labored breathing and suddenly the breathing gets even more at ease to a point whereby the breathing effort is getting less and less and less, or they start to have gasping respirations, you could see that you are moving from one worst case scenario of labored breathing to a scenario whereby the patient is hardly breathing. That is not improvement. That is what we call decompensation. If a patient decompensates, your team as a healthcare professional should be ready to resuscitate, CPR resuscitation. And the patient needs to be backed, given oxygen manually with an ambu-bag. That's how you could save this patient's life. But in our case, with Mary Jane, we were so fortunate. This was definite anaphylaxis, or even anaphylactic shock. I made a follow-up with a physician the next morning. He said, "Let me take you by the hand to ICU so that you can see what happened to Mary Jane." I was very worried that probably he means that the condition has gotten worse. When I got there, to my surprise, Mary Jane was sitting up, talking to us, and even reading magazines. This was a collective effort from all the nurses and other healthcare professionals in saving Mary Jane's life. So the take-home point here is that whenever you see a patient with an allergy, please have a high index of suspicion. Be prepared for the worst case scenario. And what is it that the patients can do at home? Go to your nearest pharmacy. Ask for what we call an EpiPen. EpiPen is a shot that has got adrenaline in it. And I promise you, EpiPen has saved so many lives. Even if you don't have the cortisones and all other stuff. But I promise you, EpiPen can really make a difference in a patient with an allergic reaction. Do not hesitate to treat an allergic reaction because it can be fatal. And thank you for watching.